Hey guys, this is Beth Avery with the trauma blog here at HealthyPlace, and today I'm going to talk about trauma therapy. So if you have post-traumatic stress disorder, it's very likely that at some point you've been in trauma therapy, you've talked about your PTSD to a psychologist or a psychiatrist, and you've walked someone through the traumatic events that you've been through. And if you've also been in therapy, you probably know that there's a saying, things get worse before they get better. And it's one of my least favorite sayings when it comes to therapy because it's true. It's true, and it really sucks that it's true. And I think it's particularly important, that saying, for people with PTSD, because what I've found over time and through the different therapists I've been with is that when you start talking about your trauma and you're really diving deep into what happened and the way it affects your life, your PTSD symptoms start getting worse. They start coming up more often. They start increasing in intensity. And it's really scary when that happens. And also very frustrating. It's happening to me right now as I'm walking through some deeper trauma therapy with a therapist. And it makes you want to just stop. It makes you want to say, okay, like, I'm not going to therapy anymore. I'm not talking about this. I'm going to put it all back inside and shut it down and lock it up and just forget it's been there. But I want to encourage you guys, if you're facing that in therapy, to not do that. Because we don't want to lock things up inside. We don't want to shut things down. We don't want to repress any memories. That's going in the opposite direction. Trauma therapy is supposed to help draw out those memories and teach us how to look them in the eye without being scared. I mean, that's the eventual end goal. So it's very normal when you're going through trauma therapy for your PTSD symptoms to get worse. You're not crazy. You're not experiencing something outside of the normal realm. It's extremely normal for that to be happening. If it is happening, you can take that as a sign that, one, therapy is going well and that you're doing the right things. You're drawing out some of those wounds. But you can also take it as a sign that maybe you need to slow down just a little bit. Doesn't mean you have to stop therapy completely, but if your PTSD symptoms are starting to get out of control to the point where they're really impacting your day-to-day life, I'd say talk about it with your therapist and see if you guys can just scale it back a little bit. Trauma therapy doesn't have a timeline. You don't have to be healed in a certain number of months or years. Trauma therapy is meant to help you learn how to live with what you've gone through. And if there are times when you need to back off, times when you need to focus on self-care, focus on dealing with the symptoms of PTSD, then absolutely do that. Your mind, it can be a little funky sometimes with PTSD, but it does usually tell you what it needs. So as you're going through therapy, listen to your mind, listen to your body, and listen to your heart, and just really give yourself what you need in those moments. So if you guys have gone through trauma therapy, I would love to hear about your experience in the comments below. Have you experienced tough times? Have things gotten worse before they got better? Let us know. We'd love to hear from you.